we have a drive-through, which the community is embracing so much. I mean, anyone who's done the drive-through is like, it's so great. They don't have to get out of the car. They just drive through and we inject them.
That's awesome.
There's directional signs on campus which show you where to go, and then you're greeted by kind of a security officer that then walks you through the rest of the process.
Okay. Hi, I'm Walter Leger. I'm a founding director of the St. Bernard Chamber of Commerce and a past chairman, also the founder of the St. Bernard Economic Development Foundation. Been around for a while in the parish. Was actually on the board of the old Chalmette General Hospital before Katrina. After Hurricane Katrina, that hospital was totally destroyed. We created the St. Bernard Hospital District Service District in order to qualify really for government assistance in the future. And fortunately, the Oxford Health Group acquired the contract to run the St. Bernard Parish Hospital. They've been a tremendous part of the community since that time. And it's my job as a member of the chamber to welcome them and introduce them and start this podcast, which is the third in a series of Chamber of Commerce informational podcasts to talk about the hospital, the people that work there that have done great service over the last year or so, and even before that, but particularly with respect to COVID. Talk about COVID and what we're doing and what people in the parish need to do. I'm going to introduce you to who we're doing the real talking, to Kim Keene and Lanny Fast. Kim is the Chief Executive Officer of the St. Bernard Parish Hospital, and the facility is managed by Ochsner Health System. Kim's been around in the healthcare community for 25 years, and Kim has a master's degree in business administration and also a Bachelor of Sciences in nursing. So has been quite active in the healthcare community. In St. Bernard Parish, she's a member of the board of the Nunez Community College Foundation. She's a member of the board and executive committee and secretary of the St. Bernard Economic Development Foundation. And she's been honored as a Woman of the Year by New Orleans City Business newspaper, a great honor. And particularly, we're pleased, that she represents St. Bernard Parish. Many other honors, including the Healthcare Hero honor and the Chancellor's Advisory Award. Kim, thank you for being with us. Also with us is Lanny Fast, who reports directly to Kim. And I understand from Lanny, what Lanny says, she does the real work at the hospital. Kim gives the orders, and Lanny. Now, they're both pretty significant parts of the community. Lanny is Louisiana raised. She's been in the hospital system. I guess you've been in Oxnard for about 10 years or so.
Yes,
Since 2010. And she's from the greater New Orleans area, University of New Orleans University of New Orleans bachelor's degree, and a master's from Southeastern Louisiana, and a member of the Women's Healthcare Executives, as is Kim, and Kim is a past president, and has been intimately involved in a lot of the operations that overall the community involving St. Bernard Parish, St. Tammany, Slidell, and otherwise. And so these are two really high-powered executives. We're fortunate to have them in St. Bernard Parish, and many of our members and others have known so much about it. So welcome. If you guys would like to say anything before we get started.
Yeah, we're happy to be here, Walter. Thank you.
Yeah, happy to help the.
Thank you. I mean, this is an incredible year that we've had, and we can't go without saying thank you for the work that we've done. I mean, we know that you have been on the front line, literally 24 hours a day, and we know that your staffs have been on the front lines, and we couldn't be more appreciative. And we're going to talk about COVID, what you've been on the front line for. Who's qualified to get the vaccinations?
Residents 55 years old or 55 years old or above are eligible for the vaccine, if you have one pre-existing serious illness as defined by the CDC, the Center of Disease Control. They're pretty much listed, but it's like cancer, chronic liver disease, chronic kidney disease, Down syndrome, heart conditions, anything that compromises your immune system. If you're obese, if you smoke, if you have sickle cell or type 2 diabetes. So 55 to 64 is the phase we're in now. It also includes all the teachers, thank goodness, from K to 12. We're glad to see that. And 65 and above for everyone in the country, 65 and above in the state of Louisiana. So that's where we are now.
So many of us youngsters don't qualify yet, but some of us do. What happens now? I understand that we can try to get in line to get a vaccination, those who qualify, by going to the website on the My Ochsner, what was it, My Chart, part of what happens if you can't get in or get an appointment that way? What do you do in that case?
So due to the limited vaccine supply, scheduling that first dose can be a little tricky right now, but we are encouraging everybody to just keep trying. As the vaccine becomes available, more appointments become available, and it's really becoming this first come, first serve if you're in those categories that Kim described. So patients also have a choice to call in, and there's a telephone number we'd like to share, which is 1-844-888-2772. Again, that's 1-844-888-2772. Patients can call that number and receive an appointment for that first dose as long as it's available there as well.
And you have any idea how long between now, if I made a call today, between now and getting an appointment?
Well, every day is different, Walter. So that's why we just have to say keep trying. Every day it updates, and you can either get the appointment or try again the next day.
Are you guys giving any particular of the two, now a third, I guess, of the vaccines that are being given? Yes.
So we actually do have access to both Pfizer and Moderna. Every shipment is different every week, so we never know exactly which one we're going to be opening until the Friday before we receive it.
And the medical community isn't discerning between the two. They're saying either one of them is just as effective and just as good, right?
That's exactly right.
The call to the state for J&J. So tomorrow morning we'll have more information. I fully anticipate we will have the Johnson & Johnson vaccine available very soon. It really depends. We'll have more information tomorrow.
Good. Okay. Now, there are a lot of people. I know every doctor I know. I'm on some boards of, public health boards, LSU, Tulane, Louisiana Cancer Research Center. So I'm talking to these doctors all the time. They're all saying, do it. I haven't heard one doctor say don't do it. There are people out there in the community, though, that are concerned in vaccinations in general, but particularly these vaccinations. So particularly a lot of women are concerned. Should women have any particular concerns in terms of fertility, sterility, women that are breastfeeding, women that may be pregnant?
Right. It's really important for each woman to kind of check with their provider before deciding, making sure they're fully informed. But talk to your science, talk to your provider. Don't look at social media for the answers, because we know it's not always reliable information. But the American Society of Reproductive Medicine has recommended the vaccine for people who are considered getting pregnant or who are pregnant. The American College of Obstetricians and Gynecologists, along with the Society for Maternal Fetal Medicine, has recommended that it is a safe vaccine for women who are breastfeeding. So the recommendation is women should be taking the vaccine. We recommend that you discuss that with your physician, but when you look at the society supporting the medicine and science behind those areas, they are openly supporting it.
Those associations and societies are like the most prestigious in their fields, right? So there's some really good doctors, high-powered doctors that have studied this before they made recommendations to other doctors. Isn't that correct? So it's a good thing. women shouldn't be any more concerned than men are, than anybody, but everybody should be doing it, correct? Now, can a person get the shot even if they've been diagnosed with COVID-19?
Yes, so we are recommending that, but we are also recommending that those individuals speak directly with their providers, because the timing of receiving their first dose may actually, or their second dose for that matter, may change depending on what type of treatments they received during their COVID-19.
In fact, that's one of the questions that's being asked when you make application, right? Have you ever had it? And do you have symptoms now, correct?
Correct.
Now, what if you have had COVID-19? Should you get the vaccination?
Yes, we also are recommending that, because really there is not enough information currently available to say how long after an infection someone is protected from getting COVID again. So it's really important, in order for us to stop the pandemic, we really need to use every tool available, and immunizations is one of those tools.
Now I've heard that that people may even be protected with an 75 to 85% efficacy after the first shot of the two. But you're still recommending they get the second one, right?
Yes.
Yes. And even after you've had the second shot, should we still be wearing masks, keep social distances, washing hands, and that kind of thing?
That's an absolute yes. You absolutely need to wear a mask while we're working on ending this, pandemic. We have not achieved herd immunity yet. There's still millions and millions of Americans that need to be vaccinated. So the best way to decrease the chance of being exposed or giving or spreading the virus is wearing masks, washing your hands, and social distancing. So if we all do that and we all get vaccinated, then eventually we'll achieve herd immunity.
I'm hearing lately something about double masking, wearing two masks.
So double masking is something that the CDC has said you can. It will maximize your protection, right? Because everyone's concerned. But if you wear your mask correctly, just your regular double layer mask, and you wear it over your nose and over your mouth, and it's tight around your face, then you have about a 95% of preventing potential infectious aerosol diseases, not just COVID, TB, other aerosol diseases. So people do double mask. If you can double mask, where you put a surgical mask and then a cloth mask over that, and you feel comfortable, and you're going into an area that may be high risk. You don't know at a football game whether everyone's been vaccinated or been wearing their mask correctly. To protect yourself, I'd probably double mask. If I was getting on a plane, I'd probably double mask. But you need to be only if you can breathe correctly.
Well, does the vaccine prevent you from getting COVID?
Well, there's not. Yes, I mean that's the reason why we're doing it, is one of the tools. But there's really not enough information to say how long it's going to protect you. So we just have to wait a little bit. But it is our first step.
Do we know, even if we have had the vaccine, theoretically 95% efficacy in keeping it from getting it, can we carry COVID and spread it? Do we know about that?
I'm not sure we know about that yet. I think we just need to be diligent in wearing our mask, washing our hands, and trying to keep some social.
And be cautious and courteous, I would say.
Let's just do what we have to do. Let's do what the doctors tell us to do. Follow good medical advice.
I think that's a good way of doing it, Lainey.
Dad, what number of vaccinations have been done in the parish? How many, what percentage of the community has gotten engaged already?
I really don't have a percentage, but what I do know is we're close to administering over 5,000 vaccines. So our first vaccination day, do you remember, Lainey?
I believe it was December 14th.
So in a little 2.5 months, that's pretty good. So that's pretty significant.
And most of our
and now, of course, those people had to be qualified too. Up until 2 weeks ago, you had to be over 70, right?
Over 70 or a healthcare worker. And
So, yeah, about two. Yeah, now it's 65, and then it's 55 with the other. Well, 55 with other things. If you're a teacher, if you have, other indications or otherwise morbidities and that type of thing, right?
And just to clarify, that over 5,000 number also includes second doses as well. That's
Okay.
a combined total.
And the other thing too, we have a drive-through, which the community is embracing so much. I mean, anyone who's done the drive-through is like, it's so great. They don't have to get out of the car. They just drive through and we inject them.
That's awesome.
There's directional signs on campus which show you where to go, and then you're greeted by kind of a security officer that then walks you through the rest of the process.
That's fantastic. There's no excuse for people that are qualified to not go to St. Bernard Parish Hospital and get vaccinated, right?
Right.
You guys are ready, rock and roll, set your appointment and go.
Mm-hmm. That's right.
Is there anything else going on? I mean, I think we've pretty much covered COVID itself. Is there anything else going on that we ought to talk about or hear about going on at St. Bernard Oxnard that you want to talk about?
Absolutely. So we're, very happy. St. Bernard Parish Hospital continues to grow. At the end of last quarter, so November, December, we actually opened our podiatry clinic. We've also just this year expanded OBGYN, urology, psychology. We've added more primary care physicians than we've historically had, which has been wonderful. And later this spring, we're very excited and delighted that we will be opening an Oxnard Health Center for Children. This will be a pediatric clinic located right here in St. Bernard in our medical office building. So that's very exciting news for the community. And we'd also like to just invite anybody, if you haven't been to the campus lately, feel free to try us out. We've recently expanded our outpatient hours of operations. So such as if you're needing lab or x-ray or a CAT scan or an MRI, we have available appointments now on the weekends, which we historically have not had. So makes it a little bit more convenient for patients to get in. We welcome all provider orders. So regardless of whether you have an Oxnard provider or not, we're happy to serve you. And we're also happy to serve you as a walk-in. You don't need a scheduled appointment either.
Fantastic. Anything else we need to know, Kim?
No, just that we're so honored to serve this community, and we were glad that we were able to support this community during COVID. It was very scary for everyone, and I know that we did a great job in providing the services so that we could take care of the patients that were so acutely ill. And just thank you to the whole community for supporting us and using us, and really, this is the parish's hospital. It's St. Bernard Parish Hospital, ran by the Hospital Service District, and we're proud to be part of it. So thank you. I really just want to say thank you to the community. The outpouring of support to us has really been incredible.
Well, thank you so much. I can tell you personally that after Hurricane Katrina in late August and early September, when we came down to St. Bernard, the other hospital was totally destroyed. And in fact, all of our homes were destroyed. And I was appointed to co-chair of the St. Bernard Citizens Recovery Committee. We had a group of business people that met, maybe 30 to 50 people that met twice a week, drove in from wherever they were living, some Mississippi's, some Baton Rouge. We had a medical advisory committee of the committee, and we were trying to figure out how and where and if we were going to rebuild St. Bernard. One of the most important things we decided as community leaders was we had to have a hospital. And that it was important to have a hospital, that that had been something that had just really emerged before the storm. It was important to do it. There was a competition between a couple of groups. We're very fortunate not to downgrade the others, but that Oxnard kind of won out, and we're particularly pleased and very proud of you guys. And I couldn't tell you, in my case, I kept thinking, us older guys who are a little bit overweight need to have some pads, down here. We don't have to go far away, just in case that we need some help. Well, you guys have been a wonderful part of the community, serving medically and otherwise. And I just personally want to thank you so much. It's been an honor to be working with you, and certainly an honor to be just kind of asking you questions.
Thank you, Walter.
Thank you so much for this opportunity.
If people have more information about Oxnard, about St. Bernard, Parish Hospital about what the services are, what they can do, or what you guys can do. What should they do? Who should they call? I know that number was 188. The number to get vaccinations was 1-844-888-2772, 1-844-888-2772. Any other suggestions to them?
Obviously they can look at our website, but I really welcome anyone in the community that wants to email me directly. My email is kane@ochsner.org. So they can email me and they can look at our website. The most important thing we can do as healthcare providers is get everyone vaccinated. We need to stop this pandemic. We need to help our nurses. We need to help our healthcare teams. They are tired. They are exhausted. They deserve a break. And the only way we're going to get the break is if we all stop spreading this disease. And so if they want to email me and I get 500 emails a day, I'll answer them because we serve this community. Lainey, do you want to talk about how to reach out or how they should contact, and I can edit it away?
Sure. I mean, we can add my email address as well. It's afast@ochsner.org.
I'll make a final editorial comment, and you can cut it out if you want, Art, but I say wear masks, wash your hands, socially distance. It's not something the government's telling us to do. It's something science is telling us to do. And it's not just for our own, even after we're vaccinated, not just for our own protection, it's for the protection of other people. It's, let's do unto others as we would have them do unto us. It's important that we go out and show that we care about other people. And to me, that's the most important thing. Let's help other people make this through. Well, thanks.
Thank you.
Good seeing you guys. I can take my tie off now.
Okay.
Thank you.
Thank you for joining this episode of the Pulse of the Parish podcast. The audio recording is available on all major podcasting platforms. Links are available below. For more of our video recordings, the most recent upload is available here, or a video YouTube thinks you'll like is available here. We'll see you next time.